Okay, hello dear students. So today we are going to discuss Insta question number 1 of a very high yielding topic from epidemiology. Okay? So your question for the day is, which of the following study designs is an analytical study design? Okay, so this means we are discussing, we have got an MCQ to answer from the topic of epidemiological study designs. So take 5 seconds and think what would be the answer to this question. Yes, is it a case report? Is it a RCT? Is it a field trial? Or is it a case control study design? So the correct answer to this question is, which out of these following is an analytical study design? It is case control. Now let us try to look, how is case control an analytical study design and what are the other options? What type of study designs are they? Okay, so we are discussing classification of, this is a very important topic, alright, of epidemiological study designs. Okay, now we all know what is epidemiology. It is the study of distribution, determinants and frequency of a disease, okay, and the application of that study to control that disease as a public health problem. Now, to be able to study about the distribution, determinants, frequency of a disease, we require certain study designs. Okay? So that is what comes under classification of epidemiological study designs. Now these are classified into two major types. Okay, one is observational, okay, and the other one is interventional. This is the major classification. Observational and interventional. Interventional, or you can also call it as experimental. Now, as the name goes, observational means you're simply observing. Okay. Experimental or intervention means you are giving certain intervention. You're doing some experiment. Alright. So that is clear to everybody. Okay. Now, next important thing. Observational study design could be of two types. Again, let's use a different color. This could be descriptive study design. Okay. Or it could be analytical study design. Okay, guys, students, is it clear to you? Descriptive means you will simply describe a disease in terms, or an event in terms of time, place and person. Alright, you're simply describing your disease. Okay. What does analytical study design mean? You are going to answer the question why and how is that disease or event occurring. Okay, so you will answer the question why. Now, what is the major difference? If your examiner asks you, what is the major difference between a descriptive and analytical study design is, in a descriptive study design, we do not have a comparison group. Okay, so in descriptive study design, we do not have a comparison group. Okay? Is it clear to everybody? We do not have a comparison group. In an analytical study design, we have a comparison group. Okay? Now, and what is interventional or experimental study design? In this, we are giving some intervention or some trial. So, the most common examples of this is, number one, it is RCT, randomized clinical control trials or clinical trials. Other examples are vaccine trials, okay. Other examples are preventive trials, okay. Preventive trials may you can use a vaccine, okay. Other examples are field trials. So trials are something where you're doing an intervention, you are giving something, okay. आप कुछ intervention दे रहे हो. In the other category, observational, descriptive, analytical. In descriptive, you're simply describing. In analytical, you are answering the question why and how. So in analytical study design, whatever study designs we have, they have a comparison group. Now, let us try to look at one thing. Now, what is the purpose of these epidemiological study designs? Okay, they are going to help you do three things. Okay, number one, they will help you formulate a hypothesis. Okay, first I'll put it here for you. They will help you formulate a hypothesis. Okay, they will help you test a hypothesis. Alright, and they will help you verify a hypothesis. Okay, so out of these, which one is helping you formulate a hypothesis, which one is helping you test a hypothesis, and which one is helping you verify a hypothesis is the question. Hypothesis क्या होता है? Any assumption which is yet to be verified. Now, suppose there is a new disease event. We do not know anything about it. So, the first step is to describe that event. So, descriptive epidemiology will help me to formulate a hypothesis. Okay, why? Because it is answering the question of the disease occurrence according to time, place, and person. Okay, then next is test a hypothesis. For testing, you always require some comparison group. Okay, so your analytical study design will help me test a hypothesis. Okay, and finally, once you've tested, you need to verify it. So you have interventional or experimental trials which will help us verify the hypothesis. Alright, this much is clear to you. Now let us look at the examples which I asked you as an MCQ. Examples of descriptive study design is very simple. Case report. Okay, case series. What is a case report? A case report is simply some unusual disease, something about a disease was found and that was reported. Case series means an aggregation of such reports is a case series. Okay, alright. In an analytical study design, what are the examples? The most common ones, you must have heard about them also. They are case control study design, okay, cohort study design, okay, ecological study designs. Okay, so these are all analytical study designs. In case control also we have a comparison group, cases control. In cohort also we have a comparison group, exposed, non-exposed. Similarly, in ecological study designs, you are comparing say the dietary consumption and breast cancer, development of breast cancer among countries. Okay, now there is one study design which is cross-sectional study design. Where to put it in descriptive or analytical? Cross-sectional study design simply describes the disease. It's like a snapshot of a population at a given point of time. You just click a picture. There is no comparison group ideally. So ideally a cross-sectional study design should come under descriptive study design also. Some places you might find it under analytical. Plus please remember a cross-sectional study design more clearly fits into a descriptive study design. Okay? So now if we go back to our MCQ, the first insta question of PSM, which of the following study design is an analytical study design? See, what is case report? If you go back, it is a descriptive study design. What is RCT? It is a experimental or an interventional study design because you are doing a trial over here. Okay? Then what is field trial? Similarly, it's this. What is left with us? Case control. This is an analytical study design. Okay, I hope this MCQ is clear to you. Two major type of division, observational, intervention. In observational, you have descriptive, analytical. Descriptive helps you formulate a hypothesis by answering the question of the occurrence of disease according to time, place, person. Analytical helps you answer the question why and how the disease occurred. And interventional is when we are giving a trial. So, I hope you're clear with the first Insta question of the day. Hello dear students. Today we are going to talk about Insta question number 2 of a high-yielding topic of epidemiology. Okay, so our Insta question number 2 for the day is, incidence of a disease can be calculated by which study design? Case control study design, cohort study design, descriptive study design, or cross-sectional study design. Now, all those questions that I am putting out on my Insta quiz, okay, are either questions that have been asked in the previous NEET PG or in FMG examinations also, or they are questions that could be asked in future. Alright, so keeping that in mind, I have designed my questions. Alright, so this question was asked in NEET PG and this is a very important question. Okay, this is one of the most important questions. So what are we asking? I am asking you here to calculate incidence of a disease. Before we go to the answer, just tell me, what do you understand by incidence of a disease? So my first question to you is, what do you, understand by incidence of a disease? ठीक है? So what is the meaning of incidence of a disease? It is nothing but the number of new cases of a disease that occur. Okay? What is it? Number of new cases of a disease that occur in a defined population at a given time. Okay? Just keep this in mind that that incidence is number of new cases of a disease. Why did I ask you this? Because if you keep this in mind, you will be able to answer this MCQ. Okay. Now let us look at the study designs. The correct answer to this question is incidence can be calculated by a cohort study design. Now let us look how. If you talk about the basic design, okay, what is the basic design of a cohort study? ठीक है? In a cohort study, what happens? देखो, remember the मूल mantra for cohort study. In a cohort study, you have to always compare exposed with non-exposed. Okay? And the second point is the outcome of a disease. Okay? The outcome of a disease has not yet occurred. ठीक है? Has not yet occurred. So, these are the two things that you need to do it. Yes. Okay. So you, in a basic design of a cohort studies, you have to compare exposed with non-exposed, and outcome of a disease has not yet occurred. So now let us look at the basic design. Okay. You have a population with you. Okay. Before, suppose you want to study, example, you want to study the association of smoking and lung cancer. Okay, you want to study this association. So how will a cohort study design work for this? You have a population, you divide it into two groups. Okay, these groups are exposed and non-exposed. Okay, so in them, exposed would be the smokers. Okay, and here it would be the non-smokers. Okay, then what you do? You follow them over a period of time. Okay, like this, both of these groups, to see how many developed a disease out of the smokers, how many do not develop the disease out of the smokers. Alright, similarly, how many developed the disease out of non-smokers and how many did not develop the disease out of non-smokers. So what are we doing here? Out of the exposed, how many developed disease? Okay, so this is the first thing. And how many do not develop disease? This is the second thing. Okay, non-exposed में भी क्या होगा? How many develop disease? Okay, and how many do not develop disease? So this is the basic design of a study, of a cohort study. आप क्या कर रहे हो? You are going forward in time. Okay, you are going forward in time. Okay, forward in time to see how many are developing a disease and how many are not developing a disease out of the two groups. Now, my question to all of you is, what is the meaning of this develop a disease, do not develop a disease in both the groups? This develop a disease indicates nothing but the occurrence of what? The occurrence of new cases of a disease. Okay? So this denotes the occurrence of new cases of a disease. And as I already told you, what is the meaning of occurrence of new cases of a disease? It is incidence. Now is it clear to all of you? And what type of study design are we writing or studying over here to calculate incidence of a disease? It is nothing but a cohort study design. So now is it clear to all of you? So if you go back to your MCQ, incidence of a disease can be calculated by cohort study design. Okay, now since we are doing it, let us just answer one more question. What are the other terms that denote a cohort study or going forward in time? Okay, so the synonyms are forward looking study. What is the other synonym? Prospective study design. Okay, what is the other synonym? Concurrent, okay, study design. All right, there is one more thing. You are going from cause to effect, from smoking to lung cancer. So this is also cause to effect. All right, also what are we there is another thing. Yes, you are also going from exposure to outcome. Okay, so all these things are the synonyms for cohort study design. Okay, if you look at the other options, why cannot it be a case control study? Because in a case control study, what happens? I'll just show you. You have population, you divide it into cases, and you divide it into controls, and you go back in time. That means you use historical data to see how many were exposed, okay, and how many were non-exposed. So in a case control, here exposed, non-exposed. Okay, so in a case control, you are finding out the exposure rate, not the incidence. We will understand case control in detail in other questions. Okay, so it cannot be a case control. Why cannot be it a descriptive study design? Because as I told you, in descriptive study design, you are simply describing a study in terms of time, place, and person. And cross-sectional tells us about the prevalence of a disease. Okay, that is new cases and old cases present at a particular point of time. So the correct answer to this MCQ is incidence of a disease can be calculated by cohort study design. I hope you are clear with this.
Hello dear students, I'm Dr. Neha Taneja and I welcome you all to Insta question number 3 of the day. Now, as we all of you know, we are doing questions on epidemiology. So today, the third question that we're going to do is, we are going to talk about a very common question. This is one of the most repeated questions from NEET PG and also from FMG and a lot of other examinations. It's a very simple question. What is the measure of strength of association in a cohort study? Is it odds ratio? Is it risk ratio? Is it cross product ratio? It is none of the above. Now, in the previous questions, we have discussed about the design of a cohort study. Now, in this, we know that why are we doing these study designs? We are conducting these study designs for two things. One is to establish an association, all right, to establish an association, and the other thing is to establish causality. Okay? So now, measure of strength of association in a cohort study is given by risk ratio. Risk ratio is nothing but, the other name for it is relative risk. All right, so I'll try and explain you over here. What does association means? It means that when two variables, okay, occur more often than expected by chance. Okay, when two variables occur more often than expected by chance, it is known as association. And the measure of strength of association in a cohort study is relative risk or risk ratio. All right, let us quickly try to see what this is. Now, suppose we have to give an association of, establish an association of smoking and lung cancer. Okay, now, if I do a study on lung cancer, I see smoking always comes. Say I'm doing it among boys. If you as a researcher do a study on lung cancer among girls, you see that smoking is always found. If somebody else does an study on lung cancer among elderly, again smoking is associated. So whoever does the study on lung cancer, somehow smoking is always there. That is the meaning of association. Okay, when two variables occur more often than expected by chance. And the measure of the strength of this association in a cohort study is given by relative risk or risk ratio. Kaise? Now, in a cohort study, what do? You compare exposed with नॉन एक्सपोज्ड, ठीक है, आप एक्सपोज्ड को कंपेयर करते हो विद नॉन एक्सपोज्ड. सो हियर सपोजिटली वी हैव लंग कैंसर, ठीक है, यहाँ पे somebody has yes, no, okay, and this side we have smoking. All right, so smoking, yes and no. All right, now how this will be A, this will be B, this will be C, this will be D. What is A? Those who smoke developed lung cancer. What is B? Those who smoked did not develop lung cancer. What is C? Those who did not smoke but developed lung cancer. And what is D? Those who did not smoke and did not develop lung cancer. Now, if you remember, what is cohort study telling us? It tells us about the incidence of a disease. What is incidence? The number of new cases of a disease that occur. So suppose this is my population. I divide it into exposed and non-exposed. All right. Then you follow up over a period of time to see how many develop the disease among this exposed group, how many do not develop the disease among this exposed group. Similarly, non-exposed, how many develop the disease, and here how many do not develop the disease. So what is this developed the disease that you're trying to find out in exposed and non-exposed? This indicates new cases. All right. And what is new cases? Nothing but incidence of a disease. So in a cohort study design, what are we doing? We are comparing the incidence. All right. We are comparing the incidence of disease among exposed with the incidence of disease among non-exposed. Okay, and this incidence of disease with exposed among comparison with non-exposed is nothing but relative risk. So let me take a fresh slide for you. In a cohort study, you are comparing incidence of disease among exposed by incidence of disease among non-exposed, and this is known as relative risk. Or in other words, what is it? You compare the risk ratio of incidence of disease among exposed. This could also be ratio of incidence of disease, all right, among exposed to that of non-exposed. All right, that is why it is also known as risk ratio. Is it clear to everybody? Therefore, if you go back to this question, measure of strength of association in a cohort study is given by risk ratio. Then what is odds ratio and cross product ratio? These are measures of strength of association in a case control study. So I hope I'm clear with this MCQ. All right. Hello, dear students. I'm Dr. Neha Taneja. Welcome to Insta question number 4 of the day. Now, as you all know, we are doing Insta questions on a very important topic of preventive and social medicine, which is epidemiology. Whatever question I've put out so far are must-know questions that you must be able to answer, and there is no scope of getting those questions wrong. So our questions for the day is, what is the measure of strength of association in a case control study? Is it odds ratio? Is it relative risk? Is it risk ratio? Or is it none of the above? Okay. Now, we all know that all these study designs, like I've told you in the previous Insta question number 3 also, all these study designs are conducted to establish association and causality. And we understood the meaning of association. In a case control study design, the correct answer to this is odds ratio. Why? Relative risk and risk ratios are measures of strength of association in a cohort study design. Okay, I'm sure everybody remembers this. Now, to understand this case control ka measure of strength of association, let us draw a picture. So, what is this? Yes, here we have a population. In case control study design, what happens? This population, we divide it into 2 groups, cases and controls. Then what happens in a case control study? We go back in time. What does this mean? What do you mean by going back in time? Means you use historical data from the past, okay, to assess how many in the cases were exposed to a risk factor and how many were not exposed to a risk factor. Similarly, in the controls, we go back in time to see how many were exposed to a particular risk factor and how many were not exposed to a particular risk factor. Is it okay? So in a case control study, what happens? This we've already read also. This is a backward looking study. Where what are you doing? Backward looking study where you are trying to find out the exposure status among the cases and exposure status among the controls. Okay, so if I draw a slide, similarly, suppose we want to study the association of smoking and lung cancer with the help of a case control study design. So यहाँ पे आपका क्या हो जाएगा? Here you are going to have lung cancer. Here not yes and no, but cases and control. Okay, and यहाँ पे आपका same, it will be like smoking, yes or no. However, in case control study design, unlike a cohort, you are not following them up. So you cannot calculate the incidence. You are simply trying to provide an estimate of relative risk. Okay, you're just going to provide an estimate. That estimate is actually odds ratio. Okay, if this is A, this is B, this is C, this is D, then you have to find out here the exposure status among cases and controls. And this odds ratio is nothing but a cross product ratio. All right, and the formula of this is, please remember, this is asked AD upon BC. They will ask you this formula and they will also ask you the calculation for it. समझ में आ गया? So this is about odds ratio or cross product ratio that you must know. The formula is AD upon BC. Okay, so since now we have done both relative risk and odds ratio, we can make a comparison. Relative risk is a measure of strength of association in a cohort study. Odds ratio is a measure of strength of association in a case control study. Relative risk is a stronger measure of strength of association. Odds ratio is a weaker measure of strength of association. All right. Also, what is the synonym for relative risk? It is risk ratio, and odds ratio is a cross product ratio. Now, why is a relative risk a stronger method of measure strength of association? Because it tells us about the incidence of a disease. So please remember, try to remember these two differences also. It is very important. Okay, so if you come back to this, the measure of strength of association for a case control study is odds ratio. So this was Insta question number 4 from epidemiology. I hope you have understood this.
Okay, hello students, welcome to Insta question number 5 of the day. So our question today is, prevalence is a type of rate, ratio, proportion, none of the above. Now, this is a very common question, but a lot of you students end up making a mistake because always you have read prevalence, that the prevalence rate of say hypertension among elderly in a slum is 50%. So you've always read it as incidence rate and prevalence rate, and so you get confused. Let us look at the real logic behind what actually prevalence is. Alright, so the correct answer to this is actually prevalence is a proportion. Why am I saying this? Look, there are three things, okay? There are three tools of measurement in epidemiology, okay? Epidemiology is about measuring the disease frequency. So there are three tools that can be used. What are these three tools? These are rate, ratio, all right? And the third one is proportion. Okay? What is rate? In rate, what happens is the numerator, all right, is a part of denominator. Let us first just put what each of these are. Okay, all right. What is ratio? Ratio में numerator is not a part of denominator. Okay, that is a ratio. All right. And what is proportion? Proportion may be numerator is a part of denominator. Now just look at these definitions. ठीक है, rate में numerator is a part of denominator, ratio is very clear, numerator is not a part of denominator, like we have sex ratio. Okay, what is sex ratio? It is number of females per 1000 males. So obviously numerator is different, denominator is different, so definitely ratio is very clear. Look at rate and proportion. Rate क्या है? Numerator is part of a denominator and proportion also numerator is part of a denominator. Then what is the difference? In rate, my multiplier is always either thousands, 10,000s or lakhs. Okay. In case of proportion, to differentiate between rate and proportion, look at the multiplier, it is 100. Okay, and when the multiplier becomes 100, it becomes a proportion. Now look at example of prevalence. Prevalence क्या होता है? How do you say prevalence? We say that suppose if I put a example, prevalence of smoking, say among university students, okay, is say 10%. When I use this word percent, am I not using a multiplier of 100? Is it correct or not? Yes. All right. So what is prevalence? Prevalence is number of new and old cases. Okay, new and old cases. But whenever we express the prevalence of anything, of a disease or an event, we express it as percentage, which means that we have used a multiplier of 100. Okay. So if I look at prevalence, the full definition is new plus old cases out of new plus old cases, all right, upon the total cases. All right, so this numerator is obviously a part of my denominator, but since my multiplier I have used is 100, that is why it becomes a proportion. Is that clear to you? So just look at this, that rate में numerator is a part of denominator, but my multiplier is different. Another example, just to make it clear, is case fatality rate. Okay, what is case fatality rate? Although I say it rate, if I ask you what is the case fatality rate of rabies, आप क्या बोलोगे? 100%. That means the multiplier in this is 100. What is case fatality? The number of deaths, okay, due to a particular disease upon the total cases due to that disease into 100. Okay, so this, the multiplier is 100 here. That is why case fatality rate actually becomes a proportion. Am I clear to you? So just look at the numerator, denominator. If both are part, if numerator is a part of denominator, look at the multiplier. अगर कहीं पे भी multiplier is 100, it becomes a proportion. So my answer to this is prevalence is actually a proportion. Hello dear students, welcome to Insta question number 6. The question is, most important criterion to establish causality is coherence of association, strength of association, temporality, or dose-response relationship. Now, this is a very important question. It's one of the most often repeated and a must-know MCQ. Now, tell me, have you ever thought, or can you tell me, why are epidemiological study designs conducted? See, epidemiological study designs are conducted for the purpose is two. One is to either show an association, okay, to demonstrate an association between what? Between exposure and outcome, okay, and the other is to demonstrate causality. Okay, now what is the difference between association and causality? Association means that two variables, okay, occur more often than expected by chance. Okay, it means that whenever somebody is doing a study on lung cancer, say among girls, smoking is there. Okay, whenever somebody is doing a study on say lung cancer among boys, smoking is there. जब भी आप study कर रहे हो lung cancer in general population, smoking is there. Okay, so we see that whenever lung cancer is mentioned, smoking is mentioned. So these two variables occur more often than expected by chance. This is the meaning of association. Causality means that causality is what? It means that the particular exposure, okay, is a cause of that outcome. That means we have to establish that smoking is a cause of lung cancer. To establish causality, we have what is known as Hill's criteria of causal association. All right. The question asked today is that which is the most important criteria of Hill's causality. Okay, so the most important criteria, guys, is temporality. Why? Let us have a look. What is the meaning of temporality? Temporality means that cause precedes effect. Okay, effect or the outcome. Here it is say lung cancer. Then cause is smoking. Okay, so smoking is always happening before lung cancer. Smoking is leading to lung cancer. So this is the most important criteria to be established, all right, in Hill's criteria. Temporality. This thing is known as temporality. Okay, to say that something is a cause of something, it has to occur before that particular outcome. All right, that is why this becomes the most important Hill's criteria, temporality. If I go a step ahead and ask you which study design can establish temporality best, yes, it is a cohort study. Okay, cohort study can establish temporality. Why? Because I've already told you, in a cohort study, you have a population, you divide it into exposed, non-exposed, follow them over a period of time to see how many develop a disease, how many do not. So since you followed them over a period of time, we are sure that that exposure has led to that outcome. So it fulfills the criteria of temporality and most important criteria of causality. Look at the other options. Coherence of association. It simply means that the results of different studies support each other. Like I just told you, okay, that smoking is always seen with lung cancer, whether it's among girls, boys. So all the results of a study is supporting each other. Strength of association is established by relative risk and odds ratio in a cohort and a case control study. Dose response hota hai, if you increase the dose, the response will increase and vice versa. So the most important criteria to establish causality is temporality. Okay.
Hello everybody, so I'm Dr. Neha Taneja. Welcome to Insta Question for the day. Now this time I thought I'm going to give you a question from family planning, which is one of the most repeated MCQs, alright, for all the entrances. Okay, so the question is, which is the most common side effect of Iucd insertion? Please remember, the most common side effect of Iucd insertion is bleeding. Okay, is it out of ectopic pregnancy, pelvic infection, pain and bleeding? Most common side effect of Iucd insertion is bleeding. Let us try to understand this. Now, it is basically increased vaginal bleeding. Okay, increased vaginal bleeding. It's mostly physiological. So all that you have to do is you have to reassure the lady, okay, reassure the female that it's going to subside. Okay, it usually subsides within 1 to 2 months. Okay, if required, you can also put the lady on ferrous sulfate tablet. Okay, you can put her on ferrous sulfate 200 milligram TDS. Okay, but ideally it should subside within 1 to 2 months. However, if the bleeding is very heavy and it is persistent bleeding, okay, then you have to remove the Iucd. Is it all right? You have to remove the Iucd. All right, if it is very heavy and persistent. And bleeding is responsible for almost 10 to 20% Iucd removals. Is it all right? This is again an MCQ question, that increased vaginal bleeding is responsible for Now another bonus question. What is the second most common side effect of Iucd insertion? So the second most common side effect of Iucd insertion is pain. Alright, but this pain is the most common cause of Iucd removal. Alright, this pain is the most common cause of Iucd removal. This is pain. Okay, this also usually subsides with minor analgesics, but this pain is responsible for almost 15 to 40% of Iucd removal. Alright, so this was Insta question number 5 for the day, where there are 3 golden points to remember. Which is the most common side effect of Iucd insertion? So it's increased bleeding. Which is the second most common cause of side effect of Iucd insertion? It's pain. And the third one, which is the most common cause of Iucd removal? It is pain. Alright, I hope I'm clear to all of you. Hello everybody, I'm Dr. Neha Taneja. Welcome to Insta Quicks of the Day. This time I thought I will talk about biostatistics. Okay, now look at this image. This is also an image-based question. Now, what is this type of distribution indicating? Is it normal distribution, positive skewness, negative skewness? None of the above. Now, please remember the correct answer to this is negative skewness. But how did we derive at it? Let us look at it. Now, usually there are 2 types of distributions that we have to study: normal distribution and skewed distribution. Okay, what is normal distribution? Normal distribution is represented by a bell-shaped curve. Okay, whenever you draw a line in between, 50% of my values are exactly above the line, okay, and 50% of my values are exactly below the line. So this is bilaterally symmetrical. Alright, but when we talk about skewed distribution, there are presence of outliers in my data set, which is going to pull my data set either to the right or to the left. Now, whether it is going to be pulled to the right or left depends on the direction of the tail. Okay, so I'm going to draw 2 figures. Look at this figure. Okay, if it is like this, okay, where is my direction of the tail pointing to? Towards the right side. So this becomes a right-sided skewness, okay, or it becomes a positive skewness. Please remember this, okay? Your data is being pulled to the right side. And if I draw another diagram like this, okay, and if it is like this, look at the direction of the tail. This is pulling my data to the left side. Okay, the direction of the tail, you have to look at which direction the tail points. Okay, so here the tail points to the left. So this becomes a left-sided skewness. Left-sided skewness is also known as negative skewed data. Okay, negatively skewed data. Now, 2 points again that you have to remember is that for a positively skewed data, okay, for a positively skewed data, which is this one, my mean is more than median is more than mode. Is it clear, everybody? And for a left-sided skewness or negatively skewed data, my mean is less than median is less than mode. So now let us look at this MCQ again. Where is the direction of the tail pointing to? It is pointing towards the left side. So it becomes a negatively skewed data. And for this, my mean statistically is less than median is less than mode. Now they can directly ask you the interpretation, or they can give you an image and ask you to mark the answer. So I hope you've understood. This is a very important repeated question from biostatistics.